Every year, 25 million people are displaced globally by sudden onset disasters. Natural hazards like floods, storms, and earthquakes cause over $18 billion of direct damages in low and middle-income countries. Without resilient homes, schools, hospitals, and public buildings, economies cannot thrive, and communities cannot meet their full potential. The recent COVID-19 pandemic showed the importance of resilience in areas such as healthcare, beyond physical and economic infrastructure. The World Bank's Global Facility for Disaster Reduction and Recovery, GFDRR, is working with countries and communities to ensure all investments are resilient to the impact of severe hazards. Let's look at two crucial sectors where GFDRR has supported building resilience. We will start with housing. The World Bank has financed 290 housing projects for $29 billion across 95 countries in the past 50 years. Housing is a fundamental human right and driver of sustainable development. But 1 billion people still live in inadequate housing today. Building better, more resilient housing is urgent and critical. Every dollar spent on housing improvements saves at least $10 in reconstruction costs. Indonesia has one of the largest home improvement programs in the world, and the GFDRR support helped raise compliance with resilient standards from just 11% in 2018 to over 75% in 2023. The impact of the project extends beyond directly benefiting the over 200,000 households in the project. It has impacted the over $1 billion spent by the Indonesian government on their National Affordable Housing Program, benefiting almost 1 million households.
So one of the really unique things that we have been able to do with the resources provided by GFDRR is not just show clients new technologies, but bring multiple technologies together for a client. Paint that cools rooftops, new methodologies, the use of drones or satellite imagery to identify vulnerable buildings.
From our work in Mexico, supporting the most vulnerable through strengthening of green and resilient housing standards, to Angola, where we have improved housing through geospatial analysis and satellite imagery of unplanned communities, GFDRR is helping governments to increase private sector participation and create jobs, to not just build back better, but build better before. Now let's look at health systems from a climate and disaster risk perspective. GFDRR, in partnership with the Japan program, is working to enhance the resilience of health systems to various shocks. In the last 6 years, the World Bank has provided almost $35 billion for health facilities and construction. Over $3 billion was spent to make these systems more disaster resilient. For example, in Colombia, where AI-based tools help to identify and prioritize the most at-risk health facilities that require upgrading based on disaster exposure and population vulnerability. This method is informing a $100 million health infrastructure investment project.
There has been a lot of assessments of hospitals or clinics and health system in general, but very rarely all of that has been combined together to inform decisions in an informative way. So what we do is we look at all the information, we work with the stakeholders to understand what does it mean for them, what is the priority for them, and then we use artificial intelligence models, like a little bit more advanced analytical methods, to then translate that to policy reforms as well as policy interventions. We try to put and identify most vulnerable people at the top.
From Morocco, where GFDRR is providing technical assistance to enhance the disaster resilience of health facilities, to Peru, where tools identified the health facilities that are most at risk, prioritized them for upgrades, and informed a project to upgrade rural roads with the goal of improving access to health and education in areas prone to natural hazards. From housing to health, by building resilient communities, we can help countries to adapt and thrive.